Because the experience isn't great when we get in touch with the NHS, it's therefore people's choice to not go when they absolutely have to, which means that the early intervention option is pretty much ruled out. And I think that's a challenge that we've learned as an organisation or are learning as an organisation in terms of the way that members of the community feel.
I think mainly it's just presumption and assumption of how Black people behave. I think people just, once they see you, they make some assumptions about you already. People may have actually experienced some things from Black people that has actually traumatized them.
There's slight differences between folks that were born here that have had the NHS and then people like me that came from elsewhere and they have a slightly different understanding of what authority means.
The Chinese community, we come from a culture of harmony and endurance and respect.
Yeah, we're trying our best to help with our members, especially in the mental health area. We try to work with NHS and then to give some support.
Whenever the community requires help to access services, they feel as if they are imposing on health services and social services. Quite often you would only see that services would come across people at crisis point.
In the Asian community, I think with depression, it's a taboo thing. We don't talk about it.
I think a lot of people that aren't actually aware that they are suffering from mental health issues.
There's a huge underrepresentation around access to services for mental health.
I think a lot of the ladies, they are not aware that they're actually suffering from mental health. I don't think they know that they're suffering with depression. If they're not aware of that, how can they get help for it?
Misuse of substance seems to appear to be a coping strategy of depression. And because suicide is not accepted within our faith, people turn more towards the drugs.
Weed or harder drugs or alcohol, and then that escalates things and makes things much worse before they get better.
People, most of the times, even feel, they don't want to be diagnosed and they refuse to get support. They're just struggling to get support.
I think that there are assumptions made about how we behave, the way we present, the way that we will react in particular situations, that before the person has even walked into the room, those assumptions are there, they're in the ether.
The community have suffered numerous hate crime attacks in social media, in real life, on the streets. The hate crime that's happened in the last 2 years have dwindled any confidence the community has in living a normal life. Members that cannot even put their bins out without being called names by neighbours from across the road.
And if you are in a setting where the people who have responsibility for your care and support largely don't look like you, there's a disconnect there in terms of understanding the needs, understanding who you are.
We have had some conversations with people about what they think is available. One of the first things people are talking about at the moment is, I can't even get an appointment with my GP. I might talk to 10 people. All of them were communicating the different processes they had to go through to get an appointment with the GP.
Certain groups of the community just do not have the tools, they do not have the support, they do not have the education, the knowledge and the know-how to access services.
The system itself has let many communities down, and I feel that our organisation has picked up those pieces. Things are changing and we're integrating better.
Ethnic background has always been a big part of what service users have felt was important for their doctors or care team to know about them, because that is a part of who they are.
We've got to always keep remembering that just because we're from a community, it doesn't necessarily mean that we're going to think the same. We're individuals within that community.
We have a job as an organisation to inform not just our partners and our colleagues, but we also have a job to inform our community.
I think things are difficult in the Asian community. Some Asian people are very closed off or very, very reluctant to talk about their problems going on. You know, whether it's at home, whether it's out of home, whether it's at work, anywhere. There is services out there that you can contact, you know, talk about these things.
Be able to be patient and just listen to people and just try to put yourself in their shoes. Also use your wealth of understanding to be able to speak over to what you've actually heard from the patient and encourage the patient to also listen to the nurses as well.
We all need to know what each other's background is. The service user already wants to talk about their ethnic background. That is who they are.
It's okay to be uncomfortable. Folks that work to collect this information sometimes feel that they can't or won't do it because they don't want an uncomfortable situation for whatever reason, either for themselves or for the other person, or usually for both. Because we can be uncomfortable, learn why we're doing it, and then get better at it and get much better outcomes.
It's easier now to have those conversations about mental illness than it was a good few years ago.
I think it's really good that there's efforts being made to talk to communities and to hear communities. When we think we've understood what the community is saying, go back and check. This is what we think you're saying. Is this what you're saying?
There's nothing wrong in asking help for your mental health issues. Nothing wrong at all. That's why the services are out there to help. Go to your GP and say, I need help. Can you help me? That is all. That's all.